Hi, my name is Caitlin Lincoln, and I am a student at ASU in the Family Nurse Practitioner program. I'm going to begin by doing a 360 of the room. Here are the supplies that I will be using and my note card. All right, so my patient's entering the room. I've knocked on the door and I've washed my hands. Hi, my name is Caitlin. I'm going to be a student nurse practitioner that's going to assess you today.
Hi.
You doing okay?
Yes.
Okay, great. Patient is alert and responsive. She is well groomed, no foul odors or like breath or body odor. She's smiling, no signs of acute distress or discomfort. She makes good eye contact, no tremors or involuntary movements, and she had normal gait when she walked into the room. Now I'm going to take a look at your skin. Alright. No lesions noted. No redness, no swelling, no hyper or hypopigmentation. Capillary refill is less than 3 seconds on her fingernails. Skin is warm and dry. Skin turgor is good, it recoils instantly. I'll take a look here as well. And bilateral lower extremities. Now I'm going to take a look at your scalp really quick, okay? Hair is thick and evenly distributed. There are no lesions, scaling, nits noted. Alright. Head is normal cephalic and atraumatic. No lumps or masses noted. Face is symmetrical. Skin on face is good color. No pallor or cyanosis noted. Lips are pink. No dryness. No cyanosis noted on the lips as well. Alright, next we're going to move on to visual acuity test, okay? Yes, if you wear glasses, go ahead and put those on. Now I'm going to stand 14 inches away from you. I want you to cover your right eye and then repeat the line or the words on the line, the letters, at the lowest setting that you're able to read.
LTFPH.
Good. Now let's go ahead and cover the other eye.
LTFPH.
Great. And now I want you to do it with both of your eyes.
LTFPH.
Good. So vision is 20/20 OD, OS, and OU. Now I'm gonna do a visual field test on you, okay? So when I do this test, I want you to just look into my eyes, and tell me when you're able to see my fingers wiggling, okay? Here we go.
I can see them.
Where? Okay. Do it. Yeah.
I can see them.
Okay, perfect. Peripheral vision is intact. Now I'm gonna look at your eyelids. Do you mind if I take your glasses off for just a minute? Thank you. Eyebrows are evenly distributed and thick. There's no thinning noted to the lateral areas. No scaling to eyebrows. Eyelids are free of lesions. I'm gonna touch her. No swelling to lacrimal ducts. Alright, now I'm gonna look at your conjunctiva. I'm just gonna pull your lower eyelids down, okay? Can you look to the right and to the left and up? Conjunctiva is moist and pink, no tearing noted. Sclera has no injection or jaundice. Alright, now I'm going to take a look at your pupils. Okay, I just want you to look straight ahead, okay? Light reflects in her pupils slightly nasally to the light. Okay, I'm gonna turn off the light really quick and dim the lights. Pupils are equal and reactive to light. Pupil size is 3 millimeters. Alright, so now I'm gonna test your extraocular movements, okay? So I want you to follow my finger with your eyes. Do not move your head. You ready? Alright, good. Extraocular movements are intact. There's no nystagmus noted. Now I'm going to use the ophthalmoscope to look at your optic disc. So I'm going to dim the lights, okay? Okay. So I want you to pick a spot just past my shoulder to stare at and just look there, okay? Okay. I'm going to turn on this light. Okay, you ready? Red reflex, intact. Okay. Optic disc is an orangish yellow. It's okay. Sorry if it's bright. And the border was clear and sharp. And we're gonna do your other eye. We'll do the same thing. So pick a spot over my left eye. And we'll do it. You ready? Alright. Red reflex is present. Optic disc is yellow. And the optic disc is clearly defined. You can see the blood vessels. The arteries are a brighter red and the veins are a darker red. I'm gonna turn the light back on. You okay? Alright. Now we're gonna move on to your ears. I'm just gonna take a look at your ears. Alright. No lesions, swelling, or edema noted to the auricles. No tenderness to auricles, mastoid, or trachea. Next, I'm going to do a hearing test on you, okay? So I'm going to stand behind you. We'll do your right ear first. So I want you to cover your left ear. And then I'm going to whisper 3 letters or numbers, and you just have to repeat them to me. Ready?
K97.
Okay, now let's do the other side.
T78.
Good. Alright. Now I'm going to use our cranial nerve 8 is intact. And now I'm going to use the otoscope to look at your ears. I've added the speculum cover. I'll take a look at this right ear first. Now I'm going to pull your ear up and back. Okay. And then we'll look at the other ear. Back. Alright. So there's no redness, edema, or swelling to bilateral ear canals. There's a mild amount of earwax in bilateral ears. Tympanic membrane to the right ear is pearly gray, no perforation. And the cone of light was at 5 o'clock. And then in the left tympanic membrane, it was the cone of light at 7 o'clock, pearly gray, no perforations. Next, I'm gonna take a look at your nose. And your nose is symmetrical, no redness noted. No tenderness upon palpation, no masses or lumps. And I'm gonna look inside of your nose and put the cover on. Would you please tilt your head back for me? Perfect. I'm just gonna put that. I'll look to the other side. Mucosa is pink and moist. Septum is midline. No deviation noted. No redness or swelling to the nasal mucosa. No drainage. Now, I want you to breathe in and out for me. Good. And we'll do the other side. Good. Airway is patent in both nostrils. And now I'm going to take a look at your mouth and your pharynx. Okay. Alright, lips are pink, no dryness noted. I'm going to have you open your mouth for me. Alright. Go ahead and stick your tongue out. Good. Tongue is midline. Oral mucosa is moist and pink. There's no lesions noted. No erosions noted to teeth. Tongue, please. Alright. Have you stick your tongue out for me again. Perfect. Now I'm just gonna look underneath your tongue. Good. Side, no lesions. And then we're gonna go ahead and stick your tongue out and say ah. Good. Uvula is midline, pink. Hard palate and soft palate, there's no lesions noted. They're moist and pink. Tonsils are pink. No lesions noted. Now I'm gonna your pharynx was also moist and pink. There's no redness or swelling. I'm gonna go back and just check your sinuses really quick, okay? Pharyngeal sinuses. Non-tender to the maxillary sinuses. Now I'm gonna take a look at your neck. Your neck is symmetrical. There are no lesions of any kind. Okay. I'm gonna go ahead and check all your lymph nodes, okay? Okay. Preauricular lymph nodes, non-palpable. Tonsillar lymph nodes, non-palpable. Submandibular and submental, all non-palpable. Preauricular, non-palpable and non-tender. Occipital, non-palpable and non-tender. Alright. Anterior cervical, non-palpable, non-tender. Supraclavicular, non-palpable and non-tender. Now I'm going to have you turn that way. And I'll check the deep vein. So non-palpable, non-tender. We'll do the other side. Also non-palpable and non-tender. Good. Alright, so next what I want you to do is kind of, let's see. I'm gonna find your, go ahead and swallow for me. Swallow again. Sorry. Okay. No nodules or goiter present in the thyroid gland. And this concludes our assessment.